Prednisone is a synthetic corticosteroid medication widely used in veterinary medicine to treat various inflammatory and autoimmune conditions in dogs. It belongs to a class of drugs known as glucocorticoids, which mimic the natural hormones produced by the adrenal glands. Prednisone works by reducing inflammation and suppressing the immune system's overactive response. It achieves this by inhibiting the production of inflammatory molecules called prostaglandins and leukotrienes, decreasing the activity of immune cells, such as T cells and B cells, responsible for triggering inflammatory responses, stabilizing cell membranes and reducing the release of inflammatory chemicals. By modulating these processes, prednisone helps alleviate symptoms associated with inflammation, such as swelling, pain, and discomfort. Common uses of prednisone in dogs. Veterinarians prescribe prednisone for a variety of conditions in dogs, including allergic reactions. Prednisone can help manage severe allergic reactions, such as anaphylaxis, angioedema, and respiratory distress caused by environmental allergens or insect bites. Autoimmune diseases. Conditions like immune-mediated hemolytic anemia, immune-mediated thrombocytopenia, and inflammatory bowel disease often require prednisone to suppress the overactive immune response. Respiratory disorders. Prednisone can alleviate inflammation and reduce airway constriction in conditions like asthma and chronic bronchitis. Musculoskeletal disorders. It can help reduce inflammation and pain associated with arthritis, spinal cord injuries, and other musculoskeletal conditions. Skin conditions. Prednisone may be prescribed for managing severe cases of allergic dermatitis, hot spots, and other inflammatory skin disorders. Cancer treatment. In some cases, prednisone may be used as a supportive therapy to manage the side effects of chemotherapy or radiation therapy. Dosage guidelines for prednisone in dogs. The appropriate dosage of prednisone for dogs depends on several factors, including the condition being treated, the dog's weight, and the severity of the symptoms. Veterinarians typically prescribe prednisone based on the following guidelines. Oral administration. The standard starting dose for oral prednisone is 0.51 mg per pound, 1-2 mg per kilogram, of body weight, given once or twice daily. Injectable administration. For injectable prednisone, the typical dose range is 0.251 mg per pound, 0.52 mg per kilogram, of body weight, administered intramuscularly or intravenously. It's crucial to follow the veterinarian's instructions carefully and never adjust the dosage or duration of treatment without their guidance. Benefits of using prednisone for dogs. When used appropriately and under veterinary supervision, prednisone can provide several benefits for dogs. Reduced inflammation. Prednisone's primary benefit is its ability to reduce inflammation, which can alleviate pain, swelling, and discomfort associated with various conditions. Improved mobility. By reducing inflammation in joints and muscles, prednisone can help improve mobility and quality of life for dogs with arthritis or other musculoskeletal disorders. Alleviated respiratory symptoms. For dogs with respiratory conditions like asthma or bronchitis, prednisone can help reduce airway inflammation and improve breathing. Suppressed autoimmune reactions. In autoimmune diseases, prednisone can help suppress the overactive immune response, preventing further damage to the body's tissues. Improved appetite and energy levels. Some dogs may experience an increase in appetite and energy levels while taking prednisone, which can be beneficial during recovery or illness. Potential side effects of prednisone in dogs. While prednisone can be highly effective in managing various conditions, it can also cause side effects, especially with long-term use or high doses. Potential side effects of prednisone in dogs include increased thirst and urination. Prednisone can cause excessive drinking and frequent urination, a condition known as polyuria and polydipsia. Increased appetite and weight gain. Some dogs may experience an increased appetite and subsequent weight gain while on prednisone. Gastrointestinal disturbances. Prednisone can cause stomach upset, vomiting, diarrhea, or constipation in some cases. Behavioral changes. Dogs may exhibit changes in behavior, such as increased aggression, restlessness, or lethargy, while taking prednisone. Suppressed immune system. Long-term use of prednisone can suppress the immune system, increasing the risk of infections. Cushing's disease. Prolonged use of prednisone can lead to a condition called iatrogenic Cushing's disease, characterized by symptoms like hair loss, muscle wasting, and abdominal distension. Delayed wound healing. Prednisone can interfere with the body's natural healing process, leading to delayed wound healing. It's essential to monitor your dog closely for any side effects and report any concerns to your veterinarian promptly. Precautions and considerations when using prednisone for dogs. While prednisone can be an effective treatment option for various conditions in dogs, it's crucial to follow certain precautions and considerations. Veterinary supervision. Prednisone should only be used under the guidance and supervision of a licensed veterinarian. Never administer prednisone to your dog without a proper diagnosis and prescription. Gradual dosage adjustment. When starting or discontinuing prednisone treatment, it's essential to follow your veterinarian's instructions for gradually adjusting the dosage to avoid potential complications. Monitoring for side effects. Closely monitor your dog for any side effects and report them to your veterinarian immediately. Regular checkups and laboratory tests may be necessary during long-term treatment. Interactions with other medications. Prednisone can interact with other medications, supplements, or herbal remedies. Always inform your veterinarian about any other treatments your dog is receiving. Pregnancy and lactation. Prednisone should be used with caution in pregnant or lactating dogs, as it may have adverse effects on the developing fetus or nursing puppies. Pre-existing conditions. Dogs with certain pre-existing conditions, such as diabetes, liver or kidney disease, or heart problems, may require special considerations or alternative treatments. By following your veterinarian's instructions and being vigilant about potential side effects, you can help ensure the safe and effective use of prednisone for your furry companion. Alternatives to prednisone for managing canine health conditions. While prednisone is a widely used and effective treatment option for various conditions in dogs, there may be situations where alternative medications or therapies are preferred. Some alternatives to prednisone include non-steroidal anti-inflammatory drugs, NSAIDs. These medications, such as carprofen, meloxicam, or daracoxib, can provide anti-inflammatory and pain-relieving effects without the systemic side effects of corticosteroids like prednisone. Immunosuppressive medications. For autoimmune conditions, medications like cyclosporin, azathioprine, or mycophenolate mofetil may be used to suppress the overactive immune response. Antihistamines. For allergic reactions or skin conditions, antihistamines like cetirizine or loratadine can help alleviate symptoms without the need for corticosteroids. Dietary modifications. In some cases, dietary changes or supplements may help manage conditions like inflammatory bowel disease or allergies, reducing the need for prednisone. Physical therapy and rehabilitation. For musculoskeletal conditions, physical therapy, massage, and rehabilitation exercises may be recommended alongside or instead of prednisone. Alternative therapies. Complementary therapies like acupuncture, herbal remedies, or nutraceuticals may be explored as adjunctive treatments in certain cases. It's important to discuss all available treatment options with your veterinarian to determine the most appropriate and safe approach for your dog's specific condition. Tips for administering prednisone to dogs. If your veterinarian prescribes prednisone for your dog, it's essential to follow these tips for proper administration and management. Follow dosage instructions. Administer prednisone exactly as prescribed by your veterinarian, ensuring the correct dosage and frequency. Timing of administration. If instructed to give prednisone with food, do so to minimize the risk of gastrointestinal upset. Gradual dosage adjustments. When starting or discontinuing prednisone, follow your veterinarian's instructions for gradually adjusting the dosage to avoid potential complications. Monitor for side effects. Closely observe your dog for any side effects, such as increased thirst, appetite changes, or behavioral changes, and report them to your veterinarian promptly. Consistent administration. Try to administer prednisone at the same times each day to maintain consistent levels in your dog's system. Storage and handling. Store prednisone tablets or liquid as directed, away from moisture and heat, and out of reach of children and other pets. Compliance and follow-up. Ensure you complete the full course of treatment as prescribed and attend any follow-up appointments or monitoring recommended by your veterinarian. By following these tips and your veterinarian's guidance, you can help ensure the safe and effective administration of prednisone for your furry companion. Frequently asked questions about prednisone for dogs. How long can a dog take prednisone? The duration of prednisone treatment depends on the condition being treated and your dog's response to the medication. Some conditions may require short-term use, while others may necessitate long-term or intermittent treatment. Your veterinarian will determine the appropriate treatment duration based on your dog's specific needs. Can prednisone be used long-term in dogs? While prednisone can be used for long-term treatment in some cases, prolonged use can increase the risk of side effects. Your veterinarian may recommend periodic breaks or dosage adjustments to minimize the potential for adverse effects. Is prednisone safe for puppies? Prednisone can be used in puppies, but it's essential to follow your veterinarian's dosage recommendations, as puppies may be more sensitive to the effects of corticosteroids. Can prednisone cause weight gain in dogs? Yes, increased appetite and weight gain are potential side effects of prednisone in dogs. Your veterinarian may recommend dietary adjustments or exercise modifications to help manage weight gain during treatment. Can prednisone be used for arthritis in dogs? Yes, prednisone is often prescribed to help reduce inflammation and pain associated with arthritis in dogs. However, it may be used in conjunction with other medications or therapies for optimal management of the condition. How quickly does prednisone work in dogs? The onset of action for prednisone can vary depending on the condition being treated and the dosage prescribed. In some cases, you may notice improvement within a few hours or days, while in others, it may take longer for the full effects to be apparent. Can prednisone be used for allergies in dogs? Yes, prednisone can be effective in managing severe allergic reactions or chronic allergic conditions in dogs, such as atopic dermatitis or environmental allergies. Is prednisone safe for dogs with diabetes? Prednisone should be used with caution in dogs with diabetes, as it can potentially affect blood sugar levels. Your veterinarian may need to adjust your dog's insulin dosage or monitor blood glucose levels closely during treatment. Conclusion: prednisone is a powerful and versatile medication that plays a crucial role in managing various inflammatory and autoimmune conditions in dogs. When used under the guidance of a licensed veterinarian and with proper precautions, prednisone can provide significant relief from symptoms and improve your furry companion's quality of life. However, it's essential to be aware of the potential side effects and follow your veterinarian's instructions carefully regarding dosage, administration, and monitoring. Regular checkups and open communication with your veterinarian are key to ensuring the safe and effective use of prednisone for your dog. Remember, prednisone is not a cure-all solution, and in some cases, alternative treatments or a combination of therapies may be more appropriate. By understanding the benefits, risks, and proper use of prednisone, you can make informed decisions about your dog's health and well-being. If you have any concerns or questions about using prednisone for your dog, don't hesitate to consult with your trusted veterinarian. They can provide personalized guidance and recommendations tailored to your furry friend's specific needs. Remember, your dog's health and happiness are our top priorities, and we're here to support you every step of the way.